Now with a story of a meteorologist who took her own life after experiencing complications from eye surgery. Now her family is speaking out. ABC's Paula Ferris sat down with them and is here with more on this. Good morning, Paula.
Good morning to you, Cecilia. Good morning, everyone. The family says that she was struggling with complications following eye surgery, a struggle that left her depressed, and sadly, she ultimately took her own life.
I'm still using drops. These things, tears, artificial tears, probably about every 5 minutes.
These are video diaries from Jess Starr, a popular Detroit meteorologist, wife, and mother of 2 young children, just a few weeks after undergoing corrective laser eye surgery in October of last year.
I want to just get back to my normal life, and right now I'm not living my normal life.
Over the course of 2 months, Starr recorded these video diaries detailing complications she says she was experiencing from a procedure called SMILE, shown in this video from Zeiss, which is the company that created the surgery. A laser makes a very small opening on the eye to remove a layer of tissue within the cornea to change its shape and correct nearsightedness. The FDA approved it in 2016 and says it's less invasive than the popular LASIK surgery. Jess's family said she'd considered laser eye surgery for several years, and her doctor told her she was a good candidate for SMILE.
I'm really mad at myself for doing this. I don't know why. I was fine in contacts. Glasses weren't that big of a deal. It was fine.
But just 2 months after her surgery, she took her own life. You believe her death is directly related to this eye surgery?
Absolutely.
Yes.
Unequivocally.
There was nothing else that we can attribute it to.
This is the first time her family has spoken out since her tragic death in December.
She really knew something was not right within a matter of days. She started to complain of incredibly dry eyes. She had almost no night vision. She had starbursts that she was seeing during the day and at night.
Her family says she had a hard time doing her job and had to take time off from work. They say they noticed a change in her demeanor and appearance.
I lost like 25, 26 pounds, and I kept saying, "Are you eating? Are you okay?" And she said, "I'm not eating and I'm not sleeping, Mom. This is worrying me. I don't think it's going to get better."
I was going to dinner by myself with the kids. I was taking the kids to the movies by myself, in the sense of she started to withdraw from
The American Academy of Ophthalmology says studies show the procedure is safe and effective and complications are very rare. The Academy says those complications can include glare and halos, particularly at night, and under or overcorrected vision. For Jess, she contacted her surgeon and saw multiple eye doctors to get their opinions. How many medications was she being prescribed?
I have collected all of the drops and medications that she was on in that 8-week recovery period.
Nothing
drops,
worked?
Nothing seemed to work, no.
She even reached out to a therapist for help. But looking back, the family realizing she'd become depressed. Before the surgery, everything was okay. There were no signs of any sort of distress, emotional, mental, physical. Work was good, life at home was good.
Absolutely.
The American Society of Cataract and Refractive Surgery tells us, as with all types of surgery, there is a healing process and the need for post-surgical care, which typically lasts from a few days to several weeks, but in some patients it may take longer. They add clinical data on SMILE shows sight-compromising complications are extremely rare at less than 1%. As for Jess's family, they are working through this tragedy the only way that they know how. It's just so sad. More than 1.5 million SMILE procedures have been performed. Now, the FDA says that Zeiss, the maker of the laser used for SMILE, is required to conduct a post-approval study so that the FDA can continue to monitor the safety and the effectiveness of the procedure. We did reach out to Zeiss. We did not hear back, but the FDA, they do track the complaints, but they say because many of the reports are duplicate or they're just incomplete, it's hard to really determine the number of adverse events specifically related to the surgery. But her family says she was a completely different person after the surgery. They're going to choose to remember her as the warm, fun-loving, gregarious wife, mother, and friend and sister that she was.
And not those 8 weeks, because it was just 8 weeks from the time she had the surgery.
Less than 9 weeks.
Wow.
So tragic.
Thank you, Paul.